Hi, thanks for watching. All right, in this video, I'd like to kind of apologize. I think I've really oversimplified my way of talking about, like, say, the neurology of cluster B and how it may be very similar to addictions. Um, I kind of believe that. I'll be honest. I kind of do believe that. It kind of makes sense to me, but I think my knowledge of the actual neurology is terrible. Okay, so I really I don't know. I thought the relationship between the dopamine and the serotonin was kind of like very universal in people. Turns out that's not true at all. And the idea of like an inverse relationship between the two systems of the dopamine and the serotonin, that's actually not some people yes, but probably for a lot of people that's not true. Um, and I think the actual neurology of addiction is way complicated and may vary according to different people. Also, people with personality disorders can have either dopamine deficits or they can even have hyperactive dopaminergic mechanism. So actually, I think there's a lot of different ways that can produce the personality disorder symptoms. So I want to leave those videos just because you can see how ignorant I am. And basically, I leave them because I'm still, the end goal of all this is believing that stability is a very good for us because, however each of us have, however our systems work for each of us, we're all different. But I think that what can be generalized, I think, with the personality disorders is that we do fall into patterns of gratification seeking. We get absorbed in gratification cycles, or even actually with like, say, narcissistic personality disorder, we can even get into long-term gratification patterns where we make a long-term identification with, like, say, our sense of who we are. Okay, even if it's kind of fantastical or kind of unrealistic, we sort of form a sense of who we are in line with what's going to be gratifying. You know what I mean? And so that does get into maybe a chronic sort of like maybe like a chronic dopamine seeking. And if we're already, let's say, depleted in dopamine, or if we're already kind of not living our lives to even optimize our baseline of dopamine, that excessive gratification that can actually produce a lot of, it's a kind of like an opioid like substance in the brain. They call it dynorphin, which is sort of like the counterpart to endorphin, and that can produce like a lot of really, like a lot of, I would say, dysthymia. Just like really, and it can actually build and build and build. The more we seek dopamine gratification, the more that stuff can really build up because the brain seeks balance. You know what I mean? So, like, even if I don't really understand exactly how it works for each person, because each person is different, the bottom line is that I think it's always going to be a good idea, almost always, for someone with personality disorder to avoid instability, and to really try to work towards stability, just with the belief, even the faith, that stability will produce a better result. Okay. The other thing I want to I want to apologize. I don't know, apologize, but just kind of really emphasize that no matter what we do, as far as like structuring our lives, and trying to get more stability, um, you know, I do think that most of us with cluster B issues, even if we become subclinical, okay, we probably do have deficiencies related to the neurotransmitters, probably related to just the configuration of how the amygdala works, how much the amygdala floods the brain when it gets activated, how when we're provoked, we probably get way absorbed in reactive, just our reactive response to provocation and stuff. So that we will probably always have risk of, like, say, anger management issues in the worst, most stressful situations. Or just we can maybe handle provocation up to a certain point, but that we should probably know that when provocation gets into our red zone or our yellow zone, we probably are at more risk of overreacting and maybe saying and doing things that we would regret, just kind of losing control. So I do think that no matter what program we set for ourselves, no matter how solid our, let's say, if we get into, like, say, a 12-step recovery, and I know I sound weird. For those that haven't seen my videos, I do advocate for people with personality disorders to to see their personality disorder kind of in the spectrum of behavioral addiction, and to maybe get involved like in 12-step recovery, because I just think it provides a lot of support when it's done properly, or when it's done with the right group or whatever. So like, no matter how solid we are with all of our recovery program, or like how we design our lifestyle, and even if we get it just right, so to speak, we are always still at risk of having at any moment, maybe an overreaction or being a little bit inappropriate, or maybe the big thing for me with NPD is that I usually try not to get too enthusiastic. I try, but when I do, I just get way too enthusiastic, and it's a dysregulation that I just, at some point I'm not going to fight it too much, but I think we do have to understand that no matter how well we get our recovery, we just have to keep in mind and just accept, I think, try to accept that we will always have the risk of at times overreacting, and maybe acting in ways that we're not proud of. And right there, that gets into that cycle where the shame, like, I'll just be honest, like yesterday, I really lost my temper. And it sucks because there's no way to make it nice. And I think when you lose your temper, even if you could argue the provocation was maybe a little bit justified, but let that go. I mean, the bottom line is that when you lose your temper, I think all of us know, if we have those anger management issues, I think we know that it's not just oh, I feel bad. It's also, there's a part of you that just feels like, you really are kind of a defective person, and it's just that feeling of the disgrace. It's like, it's disgraceful, that even if our society does have a narcissism in how we imagine the ideal human, maybe society does draw the ideal human to be a little better than what we really are. The bottom line is that those of us that are down at the bottom of the spectrum, down in the diagnosable range of personality disorders, we really do stand apart, and we really are kind of noticeable for having just a poor, just a poor response when we're really angry, and anybody who has anger management, it kind of sticks out like a sore thumb, and it's not very becoming. You know what I mean? It's just not very becoming. And so I can say that, obviously you get those feelings like I'm just a defective person, and it's disgraceful. I don't like to sugarcoat it, and I don't like these things like, well, I'm going to be nice to myself, and I'm not going to think. No, maybe it is a little bit disgraceful, and maybe we should have the guts to just kind of face that it sucks. I mean, look, people with cancer, people with heart disease, they have to face the fact they may be dead. Like, hey, a doctor tells you have congestive heart failure. You have to face the fact somehow that my heart sucks, and it sucks to be defective. It sucks to be, have something really wrong. But, I'm a believer that with courage, we can sort of digest the bitter pill, so to speak. It does suck, and it's a real hit to the self-esteem. But I think, one of the things with cluster B experience is, I think there's a difference between having trauma and being traumatized. Okay, trauma versus traumatized. I think sometimes we're traumatized by things where we're really not as injured as we think. Okay, that's so important. So like, I think sometimes when we have to swallow the bitter pills and we have to take the bruises, I think sometimes we're traumatized where we think we're just like permanently injured and it's like unbearable, when really it is bearable, but you have to maybe just have some practice taking a lot of bitter pills and maybe getting bruised a little bit. So it's kind of like going to football practice, for young people that have played football, they beat you up, and you get bruised every day. And it's like a normal person was like, this is abuse, but you can actually take some bruising, it's sort of like, it's like conditioning. I don't know how to say it. It's kind of like, I've seen people be traumatized by eating onions. Like my sister, she couldn't eat an onion, and she would cry so hard. Or if there was a little bone in her fish, and she would just cry having to eat white fish. And it's like, yeah, I think all of us have to admit that maybe we have those kind of petty. They're almost like phobias where we're just totally. I don't know how to say it. It's like a total. Intolerance of just going into the bruising, the bitterness, the things that are very uncomfortable, maybe unfavorable experiences. And to be honest, we can probably take a lot more bruising than we think. And so a lot of what we call trauma is not really trauma; it's that we're traumatized. And that I think those are very, I'm sorry, kind of infantile, really rigid positions, really rigid infantile positions that are kind of more self-imposed, and they're just kind of, we just have real rigid mechanisms where we're just really not inclined to go into really bruising, very bitter, very uncomfortable, very dark, kind of harmful, hurting experiences. And I think psychiatry sometimes allows us to sort of reinforce the idea that, oh well, this is just because I'm traumatized, I'm or not traumatized. This is because I have trauma, here. And so it's like, I think we kind of make a bigger mountain out of what really is still pretty challenging. But I think we really can take more pain and more discomfort than what we imagine. And I think when we kind of reinforce this idea that, oh, I can't do that, I can't have those feelings, I can't have those thoughts, I think we are kind of reinforcing this kind of like traumatized complex, where we just it's just the same thing as a kid that just doesn't like onions, and oh my god, I'm going to throw up, and I have to chew this thing that makes me want to throw up. And it's like, you can, maybe there's a few people that really cannot eat onions, but I think we can chew the onions, you know what I mean, at least a lot of us, and so I think I can remember the first time I had a jalapeno by accident. It made me cry. I was 6 years old, and it was just so flaming hot. And it was like, God damn, my mouth is burnt. And then, a few years later, I just decided that I wanted to try to eat jalapenos, and it was a mind game, because it really hurt. And then later, I became kind of addicted to jalapenos. So I don't know. I'm with anybody. Like, yesterday I had a hit to I guess my self esteem, just feeling, I don't know if it was shame or just disgracefulness or whatever. It was very painful, and it just almost like disabling. But I'm not going to say it's easy, because it chews you up, and you like go into the hamburger grinder. It's like, wow. But is that really trauma? I don't know. I mean, I think maybe we can take a certain amount of so-called trauma, but um, at least in my opinion. When I think of trauma, I like to leave the classic shell shock. The idea of post traumatic stress came out of World War I, and how soldiers were really exposed to almost unthinkable psychological trauma. Mustard gas, watching people get blown up, having to live in trenches with rats and disease, and getting terrible infections, and being around corpses. And I mean, come on. I mean, I think there are a few people that grow up in the worst neighborhoods and the worst families that actually do get traumatized. That do get traumatized. But I think a lot of our supposed trauma, is really just kind of like the rigid parts of us that just, kind of, um, I don't know how to say it. Um, I think a lot of our so-called trauma is just our excessive, hyperactive, reactive complexes. Okay, um, and that it really kind of like paralyzes us. But I think that some of it, for a lot of us, we could. I'm sorry to say, we could kind of like, maybe in small doses, we could sort of adapt ourselves to dealing with some of our so-called, trauma limits. And I don't know. I mean, I encourage anybody with a personality disorder to take what they think is their limit of what bitter pills they just can't go to, what thoughts they just cannot go to, whatever they think is their frontier, their limit. And instead of like just charging through the border, I would just go close to the border, and maybe just in, like centimeter by centimeter, just kind of extending what they think is their limit. Just everything in personality disorders, do in small steps. Um, that's definitely my recommendation. But just getting back to the issue of the neurotransmitters, I definitely want to apologize that every person with a personality disorder may have a different configuration with their neurotransmitters, and it may not be quite so simple. Maybe some people do have an inverse relationship between the dopamine and the serotonin, but probably for most of us, probably the dopamine and serotonin probably more or less correlate, and we probably engage in excessive gratification seeking, both in terms of serotonin or dopamine, or maybe some of us maybe in one or the other. But any of those neurotransmitters, when you get too much in a cycle of gratification seeking, okay, we will tend to build up the mechanisms in the brain that seek the balance. Okay, so when we start getting too excessive in those areas, the brain will automatically produce sort of like um, they'll produce they'll activate mechanisms that can involve things like the dynorphins, sort of like the counterpart to endorphins that can cause a lot of pain. But basically, it's the brain just trying to seek balance when we get a little too elevated, a little too outside the baseline. Okay, so basically, that can be very different for different people. Okay, what may be in common, maybe for most people, is that even if you have a deficit in dopamine, and I believe actually sometimes they want, I think, as I think about it, I think I may have a deficit both in dopamine and serotonin. Okay, probably because that would explain why I have anger management issues and why I'm really irritable and stuff like that. So, but I would say that regardless of what it is, I think what we should be seeking in our recovery is not to change the peaks, not to try to improve our mental health through the peaking or the extreme experience, but to maybe move the baseline. You know what I mean? Maybe play with the baseline, and so that involves much more stable lifestyle, and also cleaning up our lifestyle. You know, to have a better baseline in all those neurotransmitters, you have to sleep well. Okay, you have to lower your stress. Stress is really bad for baseline dopamine, and that's generalizable. Okay, so basically, we're talking about getting more sleep, and if we have problems with sleep, that's a big deal. You know, so basically, maybe you don't start maybe by sleeping better. Maybe you start by making your life less stressful. Maybe you start by getting way more exercise. Exercise is excellent for neurotransmitters, and also when you get really good exercise, you sleep better. You see, so like I really do believe that even if the neurotransmitter issues are different for each person, okay, I do think that we need to um, really go with stabilizing the lifestyle, okay, and getting a more healthy lifestyle. You know, smoking cigarettes and alcohol and getting into addictive behaviors, any kind of addictive behavior is terrible terrible for our neurotransmitters. And then from there, if we go and get a doctor to prescribe us medication, it's just, I'm sorry, to me that just sounds like, that sounds like going around eating hamburgers and French fries and then asking a doctor for like blood pressure medication. It's like, do you? I can't. I think that almost sounds masochistic. That sounds self-destructive. I mean, and of course, some people will do that. And I don't even know what to say. I just think that if you really, and maybe that comes from psychology having a fault by not putting front and center. Okay, psychology should put front and center the balance of neurotransmitters as really a central issue in personality disorders, because then people would go to that as the first issue. Okay, because psychology sort of puts that off on the shelf and it's sort of debated, and it's not really the center, okay, of what we consider to be the reason for these personality disorders. Okay, people, they also put that far away. So like they, because psychology doesn't emphasize this issue of the neurotransmitters, people feel perfectly comfortable just living unhealthily, okay, and then going to their therapist, and then somehow, yeah, I'm in recovery and I'm on the path. It's like, wow. I mean, I think it's almost the opposite. I think really front and center would be getting the life, getting the diet, cleaning up the diet, exercising, and then sleeping better. Okay, and also reducing stress. I mean, that to me would be the number one. You know, and so like if I was, God forbid, I mean, I'm not a psychologist, but if I were a psychologist, I'd say, look, we can talk all about your family, we can talk about your insights and your, how you feel about your grandiosity and all this, and what we can maybe work on some of the behaviors, whatever. But first, please, get the diet, get the exercise, get the sleep. That will not do harm to you, and it will improve the baseline, so that you can then really have a better, behavioral baseline to then work on the nasty problems of that amygdala that floods your brain, and all these other things. But I really do believe, honestly, and I'm sorry to say, but I think insight is important. I mean, it's so important to have insight, but I think because humans are storytellers and because we have cultural narcissism, we always want to make a story. Even psychology wants to make a story so that we can reinforce this ideological proposition that we're all born innocent, the innocent coming into the world. And I think that, sort of like the Lamb of God, and I'm sorry, but, I'm not saying it's wrong exactly, but I think it's so naive. And I think that these are all rationalizations and storytelling mechanisms, ideologies that are really part of, let's say, a broader, societal narcissism that, it'd be very unflattering to think of ourselves as born imperfect or having, temperamental issues, So I think, this is a broad societal debate, and it probably does involve a societal narcissism, where we want to kind of idealize a little bit our, let's say, our inner Lamb of God, or what we might have been if we weren't raised in such bad families and stuff like that. But I think that if that's even partially true, I still think it is ideological. And I think that I'm sorry. I mean, I could be wrong, but I really think we have it backwards. Okay, and I really think that you know I'll just say it. I think personality disorders are largely temperamental. Okay, and I think a lot of the mechanisms that come in, that sort of like traumatize us as we're growing up, and let's say, I grew up in a bad family too. I understand, but I think these mechanisms that come in to sort of bind us and configure us into these bad personalities or whatever, maladaptive personalities. I think those mechanisms we were born with those mechanisms. Okay, they may have been configured through our experience into a bad combination through our experience. Okay, so our experience does have to do with how we programmed and configured our mechanisms. But I think our reactive mechanisms are basically it's kind of like, when you see the tiger in the womb, the tiger, even in the womb, it starts to grow it starts to grow its claws and its fang. The fangs come after it's born, but these things the fangs and the claws are already sort of preset. It's just how they configure and how we develop these things. But I really think that our configurations and our temperaments are basically born with us, and yeah, they do get arranged by experience. But I really think that if we want to have even a chance of really doing a good job of getting into recovery, I believe, and if you don't agree, I understand. I'm offering my opinion, okay, and I understand there's a debate out there, and I understand people have different ideas, but I really think that the first step is kind of like the 12-step program. It's sort of like, are you ready? Are you ready? If I was a psychologist, I would say, are you ready to change your life? Okay, because the insight, to me, that's the booby prize. I'm borrowing that term from a psychologist, by the way. I heard who said that. Very, very cool. Um, but basically, it's like, yeah, the insight's the booby prize. Yeah, congratulations, you're self-aware, but are you willing to take the step to change your life? Like the alcoholic. Yeah, you realize you're an alcoholic. Are you ready to stop drinking? You know what I mean? And that to me is the question. So, like, I'm not saying it's easy. Okay, that's a super challenge. Okay, I'm saying it from my experience, to really give up all the gratification seeking, to give up all the insidious bullshit that we get into, to live our life in the gratification cycle. Okay, I will tell you, maybe I haven't fully entered into the world of recovery. It may, whatever. I think I have, but maybe there are little things that I still hold on to, big time, that are very gratification seeking, But, like, I'm here to tell you, it's hard as hell, If you really, really are really adapted to certain gratification, let's say, God, where does it even begin? I mean, let's say when I was younger, always trying to be in a relationship, or trying feeling like I was nothing if I didn't have a girlfriend or something like that. I mean, now some of these things are very natural. It's natural to want to have a partner, but, like, I don't know, just like maybe there was a time in my life when I was kind of seeking to have kind of like an ideal partner, and it really was kind of a gratification cycle, or just eating garbage food and stuff like that, and just maybe just also being in the habit of, I don't know, like there was a time when I wanted to read a lot of literature and just kind of be sort of like in a kind of a lofty, place of intellectual whatever, and just all these little gratification cycles. There was never a time where it really took me a long time to get to a point where I just want to take away all the sushi and take all the fancy food and just go into like the world of the metaphorical bologna sandwich. Just kind of simplify things, just get a little more modest, a little more minimal, and just work on stability. That really was a big deal. That's like eating it's like eating a bitter pill. Just like swallowing a bitter pill. And so I understand that. I understand that it's hard as hell, and I'm maybe some people would say, well, it's not even, I don't even think it's an addictive cycle. It's just who I am. Well, maybe, but changing who you are, that really is like, I don't know. I think it's analogous to somebody who knows they're an addict, but just can't quite take that step to come clean, and to change their life, you know. And so I really think if I was a doctor or a psychologist, I would say, look, great, congratulations for the insight, okay, but are you ready to change your life? Like, even starting with getting much more exercise, okay, religiously getting exercise, um, getting a clean diet, and getting sleep, getting good sleep, and then minimizing stress, finding a job where you're going to have, to kind of maybe an easy job, because a hard job can kill people. A hard job can destroy healthy people, you know. So it's not like you're going to go try to be an air traffic controller, or whatever, or like a surgical, assistant, whatever. That could be super stressful. But maybe like just working in a call center, but even that can be very stressful. But finding a job, maybe working in an office, or who knows what, maybe driving a truck, it doesn't matter. But the bottom line is, um, cleaning up our life and getting a little bit of structure so that we can start to get functional, but in a place where we're trying to really monitor the stress, and where we're getting more sleep, and where we're eating very clean and getting lots of exercise. I think those things, and of course, that's just a gateway, you know, but at least that will at least help us have more to work with in terms of our baseline neurotransmitters, and when we can improve that baseline from there, we can really work on, and I would say CBT actually, cognitive behavioral therapy, in the sense that maybe CBT hasn't really adapted to personality disorders completely, but maybe in the future they can, where they can get somebody kind of into a program where they're going to have like an addiction support network, like kind of like a 12-step program where they really have like a peer group, where they're really checking in and really supported, and and then from there, what the psychologist could do would be to give the person like assignments to really just kind of keep the structure, and have someone adhering to a really kind of a program of just kind of, literally changing their life. You know what I mean? And just kind of changing and changing, um, not directly focusing on, I'm gonna work on changing directly, let's say my arrogance or whatever, but like say changing how you manage stress in your life, how you manage like flare-ups of anger, how you manage flare-ups of when you fall into like a quick fantasy where you start to kind of depart reality. Just kind of like um, just sort of slowly building tools so that you can drive the sports car that you are. You know what I mean? Because we're not like a Honda Civic. We're more like we're like a Ferrari. If you don't know how to drive a Ferrari, you're just going to go off the road. So we're inherently unstable, like a sports car. And so you have to be a better driver, like a test pilot. And to become a test pilot, you got to go through module and module and module of like learning very specific hardcore skills, because if you don't know how to drive this car, it'll just go right off the road. You know what I mean? And so I think stability is so important for us, because we're inherently unstable, like an F-16, like a fighter plane. And so we really have to be a better pilot, and that requires a lot of training and a lot of stability, and also being very, very, very healthy. And that is I really believe that. I know people may disagree, people may not like it, but you know what? I think it may be the answer for some people, and I really hope so. So thanks for watching.